Are you experiencing hair loss and wondering why? Well, you're not alone. Hair loss is a common issue faced by millions around the globe. It's important to understand that hair loss can stem from a variety of causes, and by identifying them, we can take steps towards prevention and treatment. Today, we're going to delve into the 5 primary causes of hair loss, each with its unique set of prevention and treatment methods. Stay tuned as we dive into the first major cause of hair loss. Did you know that your genes can be a major culprit behind your hair loss? Yes, you heard it right, because number 1 is genetics. Genetics can play a significant role in hair loss, primarily through a condition called androgenetic alopecia. This type of hair loss is inherited, meaning if your parents or grandparents had it, chances are you might be dealing with it too. It's not gender-specific either. Both men and women can experience this kind of hair loss, so how does it work? Well, androgenetic alopecia affects the hair growth cycle. It shortens the growing phase and prolongs the resting phase of hair. This means your hair follicles produce shorter, thinner hair strands over time, which eventually might stop growing altogether. While we can't change our genetic makeup, there are treatments available to manage this type of hair loss. So don't worry too much. We're fortunate to live in a time where science has solutions for just about everything, including your hair loss problems. Let's talk about cause number 2. This is when hormonal imbalance and certain hormones impact your hair. Pregnancy, for instance, is a time of significant hormonal fluctuation. An increase in certain hormones can cause hair to remain in the growth phase, leading to thicker hair. But after childbirth, when hormone levels return to normal, hair enters the shedding phase, which can cause noticeable hair loss. Similarly, during menopause, a decrease in estrogen levels can lead to hair thinning and loss. Thyroid issues can also wreak havoc on your hair. Hypothyroidism, which is an underactive thyroid, and hyperthyroidism, an overactive thyroid, can both cause hair to thin or fall out. These hormonal changes can certainly be unnerving, especially when they affect your hair. But remember, these changes are often temporary. The good news is that hair loss due to hormonal changes can often be managed with the right treatment, so don't lose hope. Ever noticed more hair fall during stressful periods or illness? It's not your imagination playing tricks on you. Stress and certain illnesses can indeed lead to temporary hair loss. You see, our hair goes through a natural cycle of growth and rest. However, when the body is under extreme stress or battling an illness, more hairs than usual can enter the resting phase known as telogen. This condition, called telogen effluvium, results in a noticeable increase in hair shedding. But don't panic. It's important to remember that this type of hair loss is often temporary. Once the stressful event or illness passes, your hair cycle should gradually return to normal. Of course, managing stress through mindfulness practices, exercise, or seeking professional help can also be beneficial. Similarly, taking care of your overall health through a balanced diet and regular checkups can help keep your hair in prime condition. Remember, managing stress and staying healthy can go a long way in maintaining your hair health. Are you aware that certain medications or supplements can also cause hair loss? Let's dive into this. Some drugs used to treat cancer, arthritis, depression, heart problems, high blood pressure, and even birth control can have an unexpected side effect, which is hair loss. It's because these medications can disrupt the normal cycle of hair growth, leading to shedding. Not just medications, certain supplements can also affect hair health. For instance, an excess of vitamin A can trigger hair loss. So if you notice a sudden change in your hair, it might be worth checking if any medication or supplement could be the culprit. Remember, it's crucial to always consult your doctor before starting or stopping any medication or supplement. Did you know that your hairstyle or hair treatment can also contribute to hair loss? Yes, it's true. Certain hairstyles like tight ponytails, braids, or buns can put undue stress on your scalp and hair follicles, leading to a condition called traction alopecia. This type of hair loss is often seen in individuals who consistently wear their hair in these high-tension styles. Similarly, harsh chemical treatments, such as perming or straightening, can weaken the hair shaft and lead to breakage and thinning. But worry not, this can be easily prevented. Simply opt for looser hairstyles that don't pull at the scalp, and try to limit the use of harsh chemical treatments. Remember, your hair's health should always come before style. As we've seen, hair loss can be caused by a variety of factors. It might be due to the genetic lottery, with mom or dad's hairline giving us a glimpse into our own future. Sometimes it's hormonal changes, like pregnancy or menopause, that wreak havoc on our hair. Stress and illness can also play a significant role, sending our bodies into survival mode and our hair follicles into a premature resting phase. Certain medications and supplements can also lead to hair loss. And lastly, our own grooming habits, hairstyles, and treatments might be doing more harm than good. So, what can we do about it? Well, maintaining a healthy, balanced diet and managing stress effectively can go a long way. Avoiding harsh treatments and embracing gentle hair care routines can also help. But remember, everyone's hair loss story is unique. Consult a healthcare provider for personalized advice because understanding the cause is the first step to effective hair loss treatment and prevention.